My name is Dr. Jennifer Laman, and I'm family medicine in Hudson, Florida. And the question is, how can we decrease the spread of COVID-19? I think first, in order to know how to decrease spread, we need to understand what we're dealing with. And what we're dealing with is a respiratory virus. So respiratory viruses are spread via droplet. And what that means is anytime you cough, sneeze, or even speak, if you're in close proximity to someone, this virus can be transmitted. It's transmitted through the nasal cavity, then to the sinuses, the airways, and the lungs. And that's why many people with underlying conditions such as emphysema and COPD and asthma are more affected by the virus. So in order to prevent spread, the number one thing we can do is wash our hands. And a lot of people have misconceptions about washing their hands. Washing your hands is 20 seconds. 20 seconds is comparable to the happy birthday song. I will not sing it because you would turn off this video in a heartbeat if I tried to sing. But if you sing happy birthday, washing the fronts, backs, inside your fingers, nails, all the way up to mid-wrist is the proper way to wash your hands. If you don't have access to soap, for example, if you're out and about, using hand sanitizer is okay, but you need to make sure that the sanitizer has at least 60% alcohol content. So the make-at-home ones, we just need to be cautious with. Besides washing hands, another big thing is right now, especially wearing masks when we're out in public. That not only will protect you from other people, but it will protect other people from you if you happen to be carrying the virus and not know that you're sick yet. Stay-at-home orders are in place by the governor. We do need to stay at home. If you are an essential business or you work for an essential business, you can go to work using very special precautions, including the hand washing, wearing masks while you're out, social distancing 6 feet apart. If you are sick, you should not go to work, whether you're essential business or not. You should stay home during that 2-week quarantine. If you have a family member that's sick, you should also try to stay home. This will decrease the spread of the virus. Also, wiping down surfaces is very important. So not just your hands, but wiping down keyboards, door handles, remote controls that everybody's using in the home, cell phones. All those things need to be wiped down with approved cleaning devices, which you can find the list of approved cleaning materials on the CDC's website. Also, social distancing, I said, but even if you're out and about at the grocery store, you want to make sure you follow those guidelines. If there's arrows going one direction, try to follow those the best that you can. If someone else is not following them, then use best judgment and just try to back up to make sure that you're doing the best that you can to avoid any sick contacts. Another thing you can do to prevent the spread of the disease is if you have to cough or sneeze, rather than using your hand, you use the inside of your elbow. And then either way, every time you cough or sneeze, you should be washing your hands with either the sanitizer or the 20-second hand wash.